We continue our story here, the developing story of the equine herpes outbreak that's taken place in a couple of the states here, neighboring not only Texas, but Oklahoma, state of Kansas, and others. As we continue to relive all this for you, we're trying to do our best here at the Cowboy Channel to give you the most information that we possibly can to help horse owners all across the country that may be affected by this or quite possibly could be affected by this. We now invite in from Weatherford, Texas, and Riata Equine, that is Dr. Justin High, joining us. First off, Dr. High, thank you so much for taking time. I know vet clinics across the country, and especially in these couple states neighboring here in the state of Texas, you guys are super busy and probably getting inundated with phone calls and messages, so thank you for doing this. Dr. High, I would like for you to start off simply by just explaining kind of the basic generic part of what equine herpes EHV-1 is for the folks that out there that may have that question.
You bet. And that's where we need to start to understand what we're talking about here. Equine herpes virus, there's two types. There's EHV-1 and EHV-4. And there's three manifestations of those, or three clinical symptoms of them. The most common one is the respiratory form, the rhinitis, rhinopneumonitis, and that's what you get your flu rhino vaccines for, and that's what it's mainly intended for. There's also a strain of that affects mares that can cause abortion in the last trimester of pregnancy. That's where, like, your pregnant mare rhino shots, Prodigy, Pneumabort, things like that, Rhinomune, those are all intended for that. So there's the other manifestation of it. The one that is fortunately much less common is the neurologic strain that we're seeing an outbreak of now. All, like EHV-1 and EHV-4, can produce all three of those symptoms. EHV-1 is most commonly the one that's associated with it. Respiratory most commonly, then the abortogenic strain, and then the neurologic strain that we have now. Why you see neurologic symptoms in this is because that virus basically causes a vasculitis, an inflammation of the blood vessels in the central nervous system. So that in turn produces clots, and it produces irritated blood vessels, and that's why you have blood clots or thrombotic events inside the brain and spinal cord, and that gives you the neurologic symptoms. And depending on where they settle out and how severe they are, that determines what your horse looks like. But it is a rhinovirus. It is not contagious to humans in any way. From a herpes virus standpoint, there is no communication between species on this, just horses.
So, doctor, let me follow up on that then. What should horse owners be looking to right now? Particularly, I told you when we started, we just had 3 horses come home from the Lazy E and the BFA. So I'm personally interested in this, certainly. What should people be looking for and doing with their horses right now?
Exactly. Okay, so I'm going to go ahead and put myself in the same deal that you are. So I'm telling you things that I'm doing as a veterinarian, and I'm also doing with my kids' horses. They both college rodeo, and as soon as I found this stuff out, I did the same thing you did. I brought them home last night. What we're doing is, the most important thing is we're staying home. We're not going to the jackpot tonight. We're not having anybody over. We're not doing anything else. Our horses are going to stay here and be nice and healthy. And that is one of the most important things that we can all do, is not do any traveling for a little bit, because the more these horses move around and the more they get commingled, the longer this is going to last and the more cases we're going to have. So staying at home is number one. The other very important thing that we're going to do is take those horses' rectal temperatures twice a day, AM and PM. A normal temperature on a horse should be somewhere between like 99 to 101.5. Anything with a fever of 101.5 or above, you need to call your veterinarian. You need to make sure that horse stays there and then investigate it from that. The biggest things that we need to look at too, symptom-wise, because fevers, that's why we're temping these horses twice a day, and it is so very important. I don't care if your horse wasn't around anybody else, go ahead and do it, because that's going to be the early warning of potential symptoms to come. Fevers tend to show up ahead of neurologic symptoms. Not always, but most of the time. So what we're going to look like, that sign that you have there, the most common one that we see that everybody's familiar with is the respiratory, like fevers, runny nose, runny eyes, coughing. That's the most common. We're not typically going to see that in our neurologic horses. They may have a little bit of nasal discharge, maybe a little bit of swelling in their legs from that vasculitis, but that's what we need to look for in those. The abortogenic side of things, that's a little bit more on the mare side. That's one of those unexpected things. But from a neurologic standpoint, what we want to observe in our horses is weakness, inability to rise, loss of tail tone. A lot of times these horses will be dribbling urine because they lose the neurologic control of their bladder. So sometimes they'll have difficulty passing manure or dribbling urine. Stumbling, wobbling, leaning against the wall. Anything that, what I tell people is if they don't look right, their head's not in the feeder, and they have a temperature, you need to call me because we're going to come look at them there.
Doctor, let me follow up on that. Is there a time frame? Is there a time whereby you can think, okay, my horse has been home for however many days, no symptoms, we're okay? What is the time frame on all this?
Ideally, like if we want to go farther out, 10 days, that's usually the longest incubation period of the disease. So let's say from when we have exposure, there can be symptoms within the first 24 hours or within 24 hours. It's kind of rare. Most of the horses that you're going to see are going to be in that 4 to 6 day window of the incubation period. It can go out to 10. I'm not saying it can't be 14, but if you can get out to like 10 to 12 days and not have any symptoms after maybe being exposed or especially after a quarantine, then I have a really good feeling about those horses.
Dr. High, before we let you go, I want to give you the opportunity to let people know you guys are right here in Weatherford, Texas. So lots of horses in this area, the Fort Worth, Weatherford, Stephenville area. Are you guys available? I know you're busy, but are y'all available for calls and questions and messages? Can they reach out to y'all at Reata Equine for any kind of questions that they may have?
Yes, sir. Of course, we're trying to do our best with that. And this is one of those times where correct information is the best way to do things. So whether it's us or your regular veterinarian, you need to make sure that you get your answers from them. Another really, really good source of information is the AAEP, which is the kind of the governing body of equine veterinarians. And they have, I think, a 12-page document that does a great job of explaining all the details of equine herpesvirus, equine rhinovirus, in terms that we can all understand. It is not a specific veterinary document, but anybody will be glad to call, visit, do the best we can to take care of things, because the more everybody knows what to do the right way, the faster this is going to go away, and then we're all just going to go back to life as normal after this.
Boy, and I'm looking forward to that. The sooner the better. Dr. Justin High
Yes, sir.
from the Reata Equine Clinic out of Weatherford, Texas. Doctor, we could have gone on for an hour. I wish we had more time. Thank you for the information, and we appreciate your time and your sharing with us today.
You bet. Thank you, guys. I appreciate it.
That is Dr. Justin High from Reata Equine here, just close by us here in Fort Worth in Weatherford, Texas. Hopefully we gave you a little something there that will help you folks at home with this EHV-1 that's going on here in these few neighboring states. Stay with us. Coming up on Western Sports Roundup, we're going to talk a little breakaway roping. A special event took place at the 3L Ranch Open. Talk breakaway roping, tell you all about it when we return.